good morning. I'm Natalie Terry with Terry Realty Group, and I am here this morning with Dr. Ann Gaston of Your Life Wellness and Physical Therapy, a partner of Breakthrough Physical Therapy. Thank you so much for being here today,
Right,
so tell me, where are you from originally?
I am originally from Massachusetts and went to college in Maine, and then I've actually worked throughout the country from Maine to Hawaii and ended up in South Carolina.
That is so neat. So how long have you been in South Carolina?
I've been in South Carolina since 1994.
Wow. And all this time you've been doing physical therapy in our community?
Yes. Well, no, I've worked different areas in South Carolina, but I've been here for 12 years.
Okay. Very good. Very good. So tell me a little bit about your business and what you do.
This is a private practice, independent, and we've been here since 2013. And it was established to provide services for the community that were not offered in some of the other facilities that were here locally at the time. So we're basically manual therapy driven, evidence-based practice.
Okay. So what are some of the odd requests that you get from clients that come in?
A consistent request we get is for massage therapy, and that leads to education in that it's a different profession. We are not massage therapists. We do a lot of myofascial release and soft tissue work, but not necessarily massage therapy. So it leads to a lot of education for the patients.
Very nice. Very nice. So do you see patients oftentimes after surgery in those kinds of situations more so than people that want to exercise or have massage? Can you maybe clarify that a little bit for us?
We do quite a bit of post-surgical. Like most private practices, a big portion of what we see is probably more sprains and strains, back and neck type of injuries. That's pretty common in outpatient practices. But we do the whole gamut. We treat patients from the ages of 9 to 90 here.
Wow.
We treat young athletes as well as senior athletes that are still playing tennis at the ages of 80 plus.
That's
So
excellent.
we have a good variety of patients here, and most of them are very active adults that we see.
That's great. That's great. We want to all be like them at 80,
Yes,
right?
we do. Yes, we do.
So, tell me anything exciting going on that clients or patients should know about, new trends in the industry maybe?
We are progressing into a strong pain neuroscience education base. There's a lot of chronic pain happening out there and how our body responds to it. So we do a lot of education in regards to that in order to help patients not have to use pain medications and be able to be more functional. So we're moving real strong into that because it has a lot of research associated with it. We're also looking at growing another clinic in the next coming year in order to provide our services. We've been very well received in this community and love this community, so we're kind of expanding.
That's exciting.
Well. Yes, it's very exciting.
That's
it's very
exciting.
Yes.
And I love the work that you're doing as it relates to helping people not be medicated.
Yes.
And essentially be healed and be well.
Exactly.
So I really can understand the importance of
That's
that.
the future of our field.
It is
that direction, yes.
It is. So what's the most memorable experience you've had in working with a patient?
Probably one of the most memorable is having a lady who had a total knee, and after a couple of years, she still was not able to hike or bike or ski.
Oh.
And I treated her, and she was able to get enough range of motion in order to mountain bike and to return skiing, to return to hiking. And
wow.
She really thought it was a lost cause because it had been 2 years since her surgery. And so to this day, 10 years later, she's still doing all those things. So,
wow.
Yes.
And that is, I know that has to feel very rewarding.
Very much so. Very much so.
In what you do.
Yeah. So a lot of times we think the end when they get done with us, or if you've been someplace and stuck for a year, that there's nothing that can change it. But there's so many different ways to approach something that I think that as long as you're open-minded, there's always a chance you can make a change for the positive. So.
Right. Mm-hmm. And I think it's great that you're spreading that message in the community too.
Yes.
So tell me, what are your goals over the next year? You mentioned opening another location?
We're looking at opening another location in Waxhaw,
Okay.
and basically a sister clinic to here. Just we have a high percentage of people from Waxhaw that come to our clinic here, so that's why we decided to go there to service them a little bit closer to home. Continue to grow the pain neuroscience education. We've started a residency program, an orthopedic residency program for our PTs and PT assistants here.
Wow.
So we're really education driven and to stay up with what's new and upcoming in our field, instead of just sticking with some of the same old techniques that have been around for decades.
Right. Right. So it sounds to me like you're on the cutting edge
Yes.
of the things that are new,
Yes.
and really bringing that to the community.
I believe in education, and I have a staff that also believes in education.
That's even
And
better.
so yes,
Yeah. Really
very
good.
much so. It's a great staff here. Very good.
It's really good.
Yes.
So, what do you think? Why do you think it's important for people to use local service providers in the community?
Well, I think one reason is it's much easier to be consistent if you stay local. If you're driving a 5, 10, 15 minutes, it's going to be easier for you to attend therapy as opposed to if you're driving 30 minutes or 45 minutes or an hour, which can easily happen around here.
Right.
But also, I think that supporting local businesses just helps the community thrive. I like being here because having been here for 12 years, which means there's been a lot of change in Indian land, it's like family. And I think how you treat family is a little bit different than how you treat somebody who might be more of a stranger that you don't really even know after you see them for 5 or 6 or 8 visits. That's why I stay here, even though my other clinic is only 30 seconds from my home, but I tend to work here is because I've been in this community for so long.
Yeah.
And they've been great to us. It's an awesome community.
No doubt. Thank you so much, Leanne, for talking with us today, and taking this time to, tell us a little bit about physical therapy and what you do here in Indian Land. I'd also like to send out a note to any other businesses that if you would like to be highlighted on the website, there'll be some information, and please contact me directly. I'd love to meet you. Thank you so much.
Thank you.